Thank you for joining us for our Panhandle Health District Quarterly Update. It's October 3rd, 2024. The time is 11:30, and in attendance are Commissioners Brooks, Matari, and Duncan. Are there changes to the agenda? Nope. Hearing none. Public comment. Hearing none. Our one and only item is just our Panhandle Health District Quarterly Update with District Director Eric Hetner, and I see that we have Board Chair Dr. Fletcher with us as well. So we'll go ahead and. Pardon me?
Our honor.
Oh, thank you.
Thank you, Commissioners. I largely wanted to come down today. I do intend to continue with Dawn's quarterly meetings. I think it's important that we hear from the commissioners in all 5 northern counties on how we're doing and if there's any suggestions you have on how we could improve. Along with that, I wanted to introduce myself a bit. I know that I've met each of you in passing, and Commissioner Duncan, I've known you for quite some time in different capacities. But I grew up in Boundary County, went to school here in North Idaho. I've worked for the health district for quite a few years, and I've worked in different counties, so I have a sense of the different communities that we live and work in. I've been in the position of district director since late May, since Dawn Duffy retired. There's a number of things that I'm continuing to learn, largely with regards to community health and clinical health, or our clinical operations. But it is a fulfilling and rewarding position to date. But I would certainly welcome any feedback as far as anything that we can do or improve. As far as just a couple of brief issues that I wanted to bring to your attention that the health district is involved in is, the first one is we do continue to track the pertussis outbreak, which is largely impacting Kootenai County. To date, we have 189 cases. There's kind of a bit of good news, bad news. The good news is that it seems to be a very mild strain. We haven't had any hospitalizations or deaths associated with it. The bit of bad news is that it doesn't come with the conventional whoop or cough, which means that it's not being properly diagnosed on the outset, which is resulting in delayed treatment, which is allowing it to spread further into the community. But we continue to track that, and we'll continue to keep you updated. The other item I wanted to mention is last Thursday, myself and Jenny Gray, who's our Aquifer Protection Coordinator, did attend and present at the Kootenai County Planning and Zoning hearing on the critical material rules, or the aquifer protection measures. There was robust conversation, largely with a couple of members of Planning and Zoning. It was predominantly clarification of the rule and of the ask of the county. For edification, this is a rule the health district has since 1993. It has been largely, if not solely, funded by the Kootenai County Aquifer Protection District. We did lose that rule set in 2019. Well, actually, it was 2021. It was largely due to House Bill 316, which greatly clarified that the health districts were not a state agency. Thus, we couldn't go through the omnibus rulemaking process. So we were kind of kicked out. Our rules then expired. We have since been we've been taking action to re-implement those as a local ordinance. We've successfully had that completed in Coeur d'Alene and Post Falls. Kootenai County was actually on the forefront of that with the 5-acre rule a couple of years ago. And this hearing last Thursday was to have the inspection of hazardous chemicals that are stored and transported over the aquifer. So I expect, with the unanimous recommendation from the Planning and Zoning Board, that will be in front of you shortly. Any questions on those items, or any questions for me?
Bruce?
Well, I'm glad to see that we are working towards that. So we look forward to seeing the final product there.
Thank you.
No.
Also, Dr. Fletcher, who is our new chairman as of July, is in attendance with me today. I think he has a few comments. He will also be participating with me in the other Board of County Commissioner meetings that I will be conducting quarterly. And I'll turn it over to him.
Well, let me just get questions for you first, and then we'll hear from Dr. Fletcher. Any questions?
I don't.
Okay. So my only one is, you guys have a fentanyl task force, correct? How's that going?
We are continuing to, at this point, we are, we have the lock boxes, we have the Narcan that's available. We've had some communication with Kootenai County Office of Emergency Management, and we're actually in discussions with how we can possibly provide assistance or better partner with the county. I think part of the focus was with the inmate population at the jail and how we can play a role in treatment and recovery. But that's at the very preliminary stages. So we're actually going to be having a greater focus. Actually, there's a meeting next week to see about moving that forward.
Oh, great. All right, Dr. Fletcher.
Thank you.
If you want to push your button there, or
Make it
yeah, you got to
green,
push
yeah.
the button. So
Now you can hear me, is that it?
Yeah,
Yes.
just set it on
Mind
the-
if I stand?
no, that's
no,
totally
set
fine.
it on the table and.
Thank you,
Yeah.
thank you. Well, I didn't know I had to say some biographical comments. I'm a retired and rehabilitating allopathic physician. I was in private practice for,
Just gonna make sure it points the right way.
I
There
was
you
in
go.
private practice for 40 years in Austin, Texas. Moved to your lovely part of the world. I think you know my wife, Darla Fletcher. She's
Yeah.
the chaplain for the Marine Corps League.
Yes.
So we have attempted to integrate ourselves into the community. And something rather dramatic occurred in our civilization 4 years ago, COVID. And I don't know, I guess we all have responded in our own ways, but for me it was shock. It was electroshock to my very consciousness. And I felt at that time that it was imperative that my species, that is to say physicians, do something to fix the problem, because I feel that organized medicine, allopathic medicine, establishment medicine, that is to say the NIH, the CDC, the FDA. I once worked at the NIH while I was at Hopkins. So has some measure of reparations. We have to make amends with the American people. I won't go into the tall weeds of what that has meant, though I'll be prepared to answer any questions you want. But there are profound problems, dysfunctionality in public health and in medical delivery in general in this country. Now, I want to, before I say anything more negative, I want to say that Eric is not personally responsible for any of this. He was actually walled off in septic systems and environmental projects, and quite frankly, I approve of that, shall we say, portfolio of business that Panhandle Health has been involved in. And I think a lot of what Panhandle Health does is appropriate and has been appropriate. So the comments I want to make are not a canvas of all of Panhandle Health. In fact, it isn't even Panhandle Health. The dysfunctionality of public health is scaled all the way up to the top. There's dysfunctionality in Boise, dysfunctionality in Washington, D.C., and Lord knows the World Health Organization. So none of this is personal, and it's certainly not personal to Eric and his staff. But Panhandle Health is going to take a different direction, an entirely different direction. And the direction we take will be in large measure a response of the feedback we get from you, directly from you. We spoke briefly about the interest in Panhandle Health holding a strategic planning meeting. I think you and I have spoken of the same. And it is our hope that all of the participating commissioners, and for that matter, all of the representatives will come to our strategic planning meeting. I don't know if we'll get the representatives because I just had this thought it's when their session will just start. But Sage Dixon has said he's coming anyway. So to get direct feedback of the direction you'd like to see Panhandle Health or public health writ large take, what will be our mission? I think that's the level at which we need to reimagine what public health means. Let me give 3 examples here. We just talked about whooping cough. And so periodically, the health district puts out a public service advisory, giving a warning. Now, that's, on the whole, that is a productive exercise. But heretofore, the genesis, the creation of these PSAs comes from an administrative bowel somewhere. And the overview of the content of that PSA has not been given daylight. So moving forward, Panhandle Health is going to create a medical director's position that will be actively involved in a number of activities of Panhandle Health, to include vetting the PSAs. And should there be issues for which there's not consensus, my supposition is that 90+% of the time, what staff comes up with as a PSA will be concordant with the medical director's ideas. In other words, does the PSA in fact address reality, or is it fear pornography? Because we have experienced fear pornography. There are exaggerations wherein the PSA has nothing to do with reality. We've borne witness of this. I mean, monkeypox. We're going to see this one come along. It's a sexually transmitted disease. I mean, you don't have to move mountains to deal with monkeypox. Have condom dispensaries. I mean, there are some, I hate to be so crude, but we have to be aware of, you still have to be in contact with reality. And it doesn't do any good to just frighten people. Another area, you brought up the topic of the funds that were received for the addiction settlement. Now, heretofore, we've sort of had the Narcan dispensaries, and that's fine and all. But I have taken the opportunity to actually look at the possible allocations of those sums of money. How else can we spend this money? I mean, Narcan is nice, but Narcan just makes us into kind of a co-adaptive behavior. You overdose on fentanyl, fine. We'll give you your fix and keep you alive. And then you can go overdose again. That's not fixing the problem. That's whitewash. So Eric and I are involved in looking at programs of genuine rehabilitation. And we will collaborate with Tim Remington and the Altar. I'd like to collaborate with you. We don't have to reinvent the wheel, but we need to think deeper here. A Narcan dispensary is, again, not the problem. We have fundamental problems. So Panhandle Health is going to be front and center in attempting to address these issues. And rest assured, we will not be following some CDC organized methodology of how to rehab people. We're going to do something that will have us, shall we say, more substance to it, which is why I'm looking towards programs that have a spiritual basis. Again, the altar. I'm not saying they will be everything, but I'll just give that as an illustration of the thought process. Now, let me tell a story as it specifically relates to Sage Dixon. And I'll end on that because I've already taken too much of your time and I appreciate it. So Sage recently resigned as, H1 representative, and then shortly thereafter, the governor appointed him in a position in the Department of Health and Welfare. So I called up Sage and said, let's get together and talk about your life, because the way the newspapers put it is he was going to be regional director of health and welfare. Well, in fact, we talked about this. I said, well, darn, this is great. I know Sage, he's a good guy. Maybe we can have a handshake and collaborate on matters. So I met with Sage. And he said, well, the title I have is actually perfunctory. Really, I have a state role, and it's on the foster families. And I'm going, whoa, Sage, this is God's work. You are taking on, a lot of people were trashing him saying, oh, you just wanted a cush job that the governor gave you. The reality is he's taking on foster care. That is hardly a gubernatorial plum. I have a lot of respect for Sage in any event. So we're chit-chatting. Now, it turns out I have not always been a fan of public health. Go figure. You probably have figured as much. And I have worked with Sage and with Jordan Redmond and with Representative Gallagher and other members of and for that matter, Scott Herndon and others on legislative measures to significantly curtail the public health districts or potentially even to eliminate them. Or one that I worked with Representative Gallagher on would have done the following. Had the legislation come to pass, it would have given you the opportunity to divorce your relationship with us. That's what that legislation was intended to do. Because it would have empowered you and it would have made us more responsible to you. And of course, that was the intention of Mark Harris's legislation in 21 to take the allowance from the governor's office, put it in your hands, and then you disperse the allowance to your health districts. And it was kind of a good idea. I know Mark Harris was very proud of that legislation. So I'm having this conversation with Sage, and Sage goes, but now wait a second, Thomas. Not long ago, you wanted to dissolve the health districts. Now you're the chairman and you're looking forward to moving forward. What gives? I mean, are you a hypocrite? We have a good enough relationship that he can put me on the spot. I said, okay, I'm busted. I'm busted. But follow me here. There's a possibility we can't just give up. Okay? I haven't given up. I am testament. Right here, talking before you underscores that I have not given up and I will not give up. So let's make the following two assumptions. Let's assume Trump gets elected president. The second assumption is let's assume that he follows through on his pledge to appoint Robert Kennedy Jr. to a position of some meaning in now the reconstitution of the health institutions in this country. And I don't know how much you have been listening to Robert Kennedy, but he is a sage human being and his thoughts are spot on. Absolutely spot on. I will not rehearse them here. But should this come to pass, this country is sick, literally, not figuratively. 60% of us suffer from chronic diseases. And much of that disease comes from very primary issues at hand, toxins in our environment. Well, if you're going to clean up toxins in our environment, hello, public health. That's the direction I'm seeing us take. So, God willing, if we have the appropriate sort of permission at the federal level, then I think we can take that opportunity and run with it. And so I flipped it back on Sage. Sage says, well, Thomas, you're a hypocrite. I said, okay, Sage, given what I've just said, can you imagine that public health can remake itself? Yeah. Well, then will you come to our strategic planning meeting and participate? I will. So I make the same invitation to you. Help us move forward. Any questions?
When is the meeting?
When is?
The strategic planning meeting?
Oh, well, actually, your colleague here gave us some a recommendation. We were thinking in January, but in preparation for that meeting, the idea, if I may plagiarize you.
Well, that is what we talked about doing. Go
Yeah.
ahead, please.
The idea is that we should hold a number of town halls in all 5 counties as sort of a preliminary exercise to harvest ideas. Just get more of the people involved. I mean, if we're going to rehabilitate trust, if we're going to try to make it so that you can trust us again, then we're going to have to reach out and do the appropriate work. And so that, I love that idea. We'll have town halls. You know, we may have to kick this until, and then of course if we have the legislative session, you know, Commissioner Duncan, I can't answer you. Let's talk about this. What would be the best timing here? Because I would like to get the legislators involved, but that of course is their heyday. They're gone. They're preoccupied. They can't think of anything other than what's going on in Boise. I don't want it sooner than that. I don't want it in December because I think we have more work to do.
I think April.
What are your thoughts?
April would be the soonest, but you never know if the legislative thing's going to run over. So May is usually a little bit of that transition time where you can still gain their attention, and they haven't really just gone into summer mode. So I would say probably May, early May maybe.
And that works with us because if we hold these town halls, it gives us more time to harvest information. And we can sort of begin to organize our thoughts. And we will have ongoing dialogue too before we pull off the strategic planning meeting. Okay, so duly noted. Any other questions?
Nothing. I mean, just to make sure that for me, and I was on board with all those, public health things because I think as a commissioner, I felt a little bit out of control and didn't have a lot of input in it. But with Eric on board and, with the change in the board, I think that I still want to make sure we're looking at restaurants, right? The restaurant inspection, the critical materials, the 5-acre, septic. I think those things are very crucial. And then looking at the public health side to say, okay, what programs should we continue with because they're actually being utilized, they fill a hole in our community versus those that we really don't need to offer anymore. So just along those lines. So, yeah.
Sir?
Well, Dr. Fletcher, there's a kind of refreshing common sense approach that you are bringing here. And so I look forward to what you and Director Kettner can do with Panhandle Health. I will say that I do believe that Panhandle Health breached a lot of public confidence when I believe they redefined the word quarantine and imposed a mandate on this community. I'm a big believer that we should be providing information, good information, so people can make good decisions for themselves and not necessarily tell people, healthy people at the time, what they need to be doing. So I'm very much for providing this community good information so they can make good decisions. And the only other comment I would have is I would suggest that we look even further upstream with addiction. Because treating addiction and getting to people before they're addicted are two different things. And, I think that we could get more return on our investment if we could intervene before people become addicted as opposed to treatment after they become addicted. Because I agree with you, having Narcan around to allow people to go back out again only to have the Narcan again for them is doesn't really get us anywhere. It just it kind of enables, in essence, the continued behavior. But the young kids who suffer broken families, things like that, it's a kind of pain that when they move into their teenage years, they seek ways to numb that pain. And if we can get to them before that moment, I think we can get a lot more return on our investment. So that's just an idea from me. a thought. But outside of that, thank you.
Amen.
Your
Your
microphone.
words are poignant. Amen. Duly noted.
And Matt,
Sir?
I think you've got a long way to go to rehabilitate people's view of public health. And you're right, from the local level all the way up to Washington DC. People are just like, they're either neutral or they're negative when they hear the idea of public health. That's unfortunate, but it can be done. But what we do here starts here. I don't know if you agree with that or not, but
Oh, sir.
we really don't have a good reputation.
Right. May I respond?
Sure.
There is a distinct possibility we will fail. And let me add to that statement that I have no confidence in any institutions in the American civilization currently. Any. They are all corrupt. 100% of them. Including NIH, CDC, FDA.
I know.
Okay, so do I stand before you with Pollyannish optimism that, oh, we're going to succeed? No. If I were a betting man, I would propose that we're not going to succeed and we will have to sort of remake ourselves in the ashes of history. That's actually where I intellectually am. But emotionally, I want to believe that I have a reason to get up each day and try to do something. So I'm thoroughly disabused of any notion that we will succeed. Believe me.
Okay.
Any more so than we can rehabilitate the FBI. I don't think we can succeed there either.
I was a hospital administrator in Alaska. And I had all I could do to get people to put their septic tank on one side of their property and their well on the other.
Oh my.
So oftentimes they were co-located, and I'm going, don't drink that water.
Right.
But it was ingrained. It was ingrained. And after COVID, that just slam dunk public confidence.
By the way, I want to give you three thanks for something. Specifically, because not too long ago, the board of Panhandle Health was populated by deadwood, individuals who were incapable of independent thought. And you appointed 2 new board members, both of whom invigorated the board and by extension have transformed the board. Thus, I stand before you. I could not have stood before you prior to your appointments. So just thank you for making the appointments you made.
You bet. Mr. Kettner, you're good? Okay. Well, we sure appreciate the update and wish you a lot of success in your next endeavor of public outreach and look forward to being part of that outreach. So,
Have a blessed day.
all right, thank you.
Thank you.
All right, I'll call for public comment one more time. Nobody online? All right, and 11:58, meeting adjourned.